Okay, so today we're going to dive into something pretty heavy, pretty serious. Polycystic kidney disease,
Hmm.
PKD. We've got these medical notes from a patient exam, and honestly, they're like a window into how impactful this condition can really be.
Yeah, it is. It's fascinating how much we can tell, like glean from just, a few observations and test results.
Yeah, exactly. Like right off the bat, the notes mention this large mass
Right.
that doesn't move when the patient breathes.
Yeah.
Can you even imagine having something that big in your abdomen?
It's a classic sign of an enlarged kidney, unfortunately.
Wow.
And when when we take that along with the mention of the multiple abdominal scars and an AV fistula on the patient's arm, it kind of paints a pretty clear picture.
So an AV fistula, that's that surgical connection between an artery and a vein
Precisely.
for dialysis.
Yes. Yep. So sadly, it seems like this patient's kidneys have gotten to a point where they can no longer function on their own.
Wow. So this is someone whose life has been like significantly altered
Yeah.
by PKD.
Mm.
But let's back up a bit. How would someone even realize they have this condition in the first place?
Well, sometimes it's, caught during some routine blood work or if there's a family history,
Right.
since PKD is genetic. But, oftentimes it's the symptoms that raise the red flags, so to speak.
Yeah.
Like persistent flank pain or recurring UTIs, urinary tract infections, or even like, high blood pressure that's really hard to control.
Okay. And once there's a suspicion of PKD, what happens next? What do you do?
Well, imaging studies, usually like an ultrasound or CT scan can actually, they can visualize those cysts on the kidneys.
Wow.
And genetic testing can, confirm the diagnosis and even tell us which type of PKD it
Oh,
is.
so there are different types.
Right. The notes mention the PKD1 and PKD2 genes. Those are the most common culprits. And knowing which gene is involved can actually sometimes predict how quickly the disease is going to progress.
Wow. So your genes can kind of give you a glimpse into the future
Right.
of your disease?
It really does.
Both amazing and a little bit scary.
It is, yeah. It really underscores the power of genetics in modern medicine.
Yeah.
And in this case, knowing the patient has that PKD1 mutation means they're likely to face kidney failure at a younger age.
Wow.
So that adds a whole other layer of complexity really to their care.
Yeah, definitely. The notes also mention that this patient underwent a nephrectomy.
Right.
I, that means kidney removal, but
Yeah.
why would someone need that?
In this case, it was probably done to prepare for a kidney transplant.
Okay.
The left kidney was probably so enlarged that it needed to be removed to make room for a healthy donor kidney.
Oh, wow. That must have been a difficult decision for the patient.
Absolutely.
I mean, that's not just surgery. That's a huge life change.
Yeah. It really highlights the fact that PKD is a progressive disease. And even with a transplant, it's a lifelong journey of careful management.
Right.
Um, the notes also point out that this patient is likely receiving hemodialysis.
Okay, so let me just get this straight. So we've got someone with PKD. It has caused their kidneys to become massively enlarged. They've had one kidney removed and are now on hemodialysis, potentially waiting for a transplant.
Right?
This is serious stuff.
It is.
And we've only scratched the surface.
We've only just begun.
What else do these notes tell us about the challenges this patient might be facing?
Well, one of the key things to remember about PKD is that its effects they extend far beyond the kidneys themselves.
Oh, right. Okay. So what else are we looking at here?
Well, for one, high blood pressure is a very common complication,
Hmm.
and that needs to be managed very carefully. And then there's also the increased risk of aneurysms, which are, those bulges and blood vessels
Right.
that can rupture, and that's a serious concern as well.
Yeah, and I imagine living with all of this, I mean, it's got to take a huge toll on someone's emotional and mental well-being too, right?
Oh, absolutely. The impact of PKD on a person's life goes way beyond the physical symptoms, that's for sure.
Right.
We'll dive deeper into that aspect a little bit later, but for now, let's focus on what these notes tell us about, the specific challenges of dialysis for someone with PKD.
Okay. So the notes specifically mention hemodialysis. Is that different from peritoneal dialysis?
Yes. It is, and it's a crucial distinction, especially in the context of PKD.
Okay.
So peritoneal dialysis, that it uses the lining of your abdomen
Right.
as a filter,
Mm.
but with PKD, the kidneys are already enlarged,
Right.
and then the fluid that's needed for the procedure, it just increases the risk of discomfort and infection.
Yeah.
Oh, okay.
So that explains why hemodialysis is the likely choice for this patient.
Gotcha. Okay. But how exactly does it work? Hemodialysis.
Well, basically, it's like an artificial kidney
Okay.
outside the body. The patient's blood is circulated through a machine that filters out waste products and excess fluids, and then it's returned to the body. It's a pretty incredible feat of engineering, really.
Yeah, I can only imagine what it must be like to rely on a machine to do the work of your kidneys. What's life like for someone on hemodialysis?
It's a big adjustment for sure. Hemodialysis usually requires, several hours hooked up to a machine multiple times a week.
Wow.
And there are, dietary and fluid restrictions that they have to manage as well.
Right.
But despite the challenges, it really is a lifeline
Yeah.
for people with kidney failure. It gives them the chance to live longer
Yeah.
and hopefully make it to transplant.
This deep dive has been eye-opening so far. We often take our kidneys for granted, I think, until something goes wrong.
We do.
What stands out to you about this patient's case?
I think for me, it's the reminder that TKD is a complex systemic disease. It's not just about the kidneys.
Right.
It's about, the domino effect that it had on the entire body from blood pressure to blood vessels and even beyond.
So where do we go from here? What other aspects of PKD do we need to explore to really understand this patient's journey?
Let's shift gears and talk about the emotional and social implications of living with this condition.
Okay.
Because, while science and medicine can, they can tell us a lot, it's the human experience that truly reveals the impact of PKD, I think.
Yeah, I think you're right. It's easy to get caught up in those medical details and forget about the human side of things.
Yeah. It is. It's understandable. PKD is a complex condition, and it can be, overwhelming to try to grasp all the medical intricacies.
Yeah.
But it's crucial to remember that we're talking about real people here, not just a collection of symptoms.
Exactly. So let's delve into that human experience. What are some of the emotional and social challenges someone with PKD might, face?
Imagine this. You're in your 20s or 30s. You're maybe just starting a family or building a career. And you get hit with this diagnosis, a chronic progressive disease that could ultimately lead to kidney failure.
Wow. That puts things into perspective.
Yeah.
It's not just dealing with, the physical symptoms. It's
yeah.
it's like facing the uncertainty of the future.
Exactly. The emotional toll can be immense. Anxiety, fear, even a sense of grief
Wow.
over the life you envisioned. These are all very real, very valid emotions.
And then there's the impact on relationships.
Yeah.
How does PKD affect the way someone interacts with their loved ones?
It can be tough. Some people, they might feel like they're burdening their family and friends
Right.
with their illness, while others might just, withdraw and isolate themselves. And then there's also, the added stress
Yeah.
of managing, all the practical aspects of the
Oh.
disease, the doctor's appointments, the treatments, the lifestyle changes.
Speaking of lifestyle changes, the notes mention this patient has a family history
Right.
of PKD. What does that mean for their relatives?
That's a crucial point because PKD is genetic,
Yeah.
family members of someone with the condition are, they're at increased risk themselves. So genetic testing can be a double-edged sword.
Yeah.
It can provide answers, but it can also, bring up a lot of anxiety and difficult decisions.
Imagine finding out you might have inherited a condition that could significantly impact your future.
Yeah.
That's heavy stuff.
It is, and it highlights the importance of, open communication within families, sharing information about PKD, talking about the risks, and supporting each other through genetic testing. These are all crucial steps.
So knowledge and support are key,
Yeah.
both for the person diagnosed with PKD and for their loved ones as well. But let's go back to the patient we're focusing on today. What resources and support systems are out there to help someone navigate the challenges of living with PKD?
Well, thankfully, there's a growing network of support available these days. Support groups, both in person and online can provide a sense of community and shared experience.
That sense of belonging can make a huge difference, I think, just knowing you're not alone. You like
Absolutely.
this journey?
It can be incredibly empowering.
Yeah.
And it's not just about the emotional support. These groups can also be a valuable source of practical information and tips for managing the day-to-day challenges of PKD.
Like figuring out how to navigate those dietary restrictions or finding creative ways to stay active despite, the fatigue.
Right.
Just sharing those experiences can be so helpful.
Absolutely. And beyond support groups, there are also, mental health professionals who specialize in working with people with
Okay.
chronic illnesses.
Mm.
And they can provide, tools and strategies for coping with the anxiety, the depression, the emotional roller coaster that often comes with PKD.
It's a good reminder that taking care of your mental health is just as important as taking care of your physical
As
health,
it is.
especially when you're dealing with a chronic condition like this.
You're absolutely right. And there are, resources out there to help people access these support systems. Organizations like the PKD Foundation, they offer a wealth of information. They connect people with local resources, and they advocate for, more research and better treatments.
So it's not just about individuals navigating this journey alone. It's like a whole community
Yes.
coming together
Yes.
to provide that support.
Yeah,
Raise awareness and push for that progress.
exactly.
But for someone who's just been diagnosed with PKD,
Mm.
it can be hard to know where to start.
Yeah.
What advice would you give them?
Well, the first thing I'd say is don't panic.
Yeah.
Take a deep breath, gather information from reliable sources,
Mm.
and talk to your doctor.
Yeah.
Ask questions. Be your own advocate, and remember that, knowledge is power.
It's about taking control of your health journey
Right.
and finding a healthcare team that you trust
Exactly.
and can work with.
Yeah. And I'd also encourage them to connect with others
Yeah.
who have PKD, whether it's through, a support group or an online forum or just talking to someone who understands. Sharing those experiences can be incredibly validating and helpful.
It's about finding that sense of community and realizing that, you're not alone in this.
You're not.
And of course, there are lifestyle changes
Right.
to consider.
Absolutely. Managing blood pressure, making healthy dietary choices, staying hydrated, finding ways to incorporate, some gentle exercise into your routine.
Right.
These are all things you can do to help, slow down the progression of PKD and manage your symptoms.
It's about focusing on the things you can control,
Yeah.
even in the face of, a condition that can feel like really overwhelming at times.
Exactly. And remembering that even small changes can
Yeah.
make a big difference
Right.
in the long run.
Yeah.
It's about taking an active role in your own health and well-being.
Yeah.
And as we continue to learn more about PKD and develop new treatments,
Yeah.
there's reason to be hopeful.
That's an important message.
Yeah.
So we've talked about the emotional and social aspects of PKD, the resources that are available, the importance of lifestyle changes. But what about the bigger picture?
Yeah.
What are some of the broader implications of living with a chronic condition like this?
That's a great question. And it brings us to a crucial aspect of the human experience with PKD, and that's the impact on identity and self-perception.
Okay.
When you're dealing with a chronic illness, it can be very easy to let the disease define you.
It's like PKD becomes the lens through which you see yourself and the world.
Exactly. And that can be a real struggle.
Yeah.
But what's important to remember is that, you are not your disease. You are a whole person
Right.
with unique strengths and talents and passions.
It's about holding on to that sense of self, even amidst,
Yeah.
the challenges of PKD.
Absolutely. And it's about finding ways to live a full and meaningful life, even with the limitations that PKD might impose. It's about adapting, adjusting, and finding joy in the everyday moments.
Yeah, I love that perspective.
Is that good?
It's about resilience. It's about finding that inner strength
Yeah.
to navigate, the ups and downs of living with a chronic condition.
Precisely. And it's about recognizing that you're not alone in this journey.
Yeah.
There's a whole community out there, people who understand your struggles and who are cheering you on.
It's inspiring to see how people with PKD find ways to to not just cope, but truly live their lives to the fullest.
It does. It speaks volumes about the human spirit, doesn't it? There's
Wow.
this incredible ability to adapt and find meaning even in the face of adversity.
This deep dive has really opened my eyes to like the multifaceted nature of PKD.
Yeah.
We've explored the science,
Mm-hmm.
the treatments,
Yeah.
the emotional impact, and even the social aspects.
It is multifaceted.
But as we wrap up, I want to circle back to those patient notes for a moment.
Okay.
There's a detail we haven't discussed yet. The mention of a scar on the patient's chest, possibly from a previous line insertion for hemodialysis.
Ah, yes. That seemingly small detail, it really does speak volumes about the long-term reality of
Yeah.
PKD for many patients. Dialysis is often a necessary bridge to transplantation.
Yeah.
And it can go on for years.
It's a stark reminder, I think, of the the physical and logistical challenges
Yeah.
that people with PKD face on a daily basis.
It is.
It also, highlights the need for ongoing research and innovation
Yeah,
in the field of dialysis. We need to find ways to make this life-sustaining treatment more comfortable, more efficient, and more accessible.
absolutely.
Speaking of research, what are some of the most promising advancements happening in the world of PKD right now?
Oh, there's a lot to be excited about.
Oh, good.
Scientists are exploring a range of approaches from gene therapies,
Wow.
that target the root cause of the disease to drugs that aim to, slow down or even halt cyst growth.
So there's real hope for a future where PKD is either cured or at least managed much more effectively.
Definitely. And beyond those cutting edge therapies, there's also a lot of focus on improving the quality of life for people with PKD. Researchers are looking at better ways to manage pain, control blood pressure, and address the various complications that can arise.
It's encouraging to know that progress is being made on multiple fronts.
Right.
But beyond, the scientific advancements, what else needs to happen to truly improve the lives of people with PKD?
Well, awareness is key.
Okay.
The more people understand PKD, the more likely they are to recognize the symptoms, to seek early diagnosis,
Right.
and to support research efforts.
And early diagnosis can make a world of difference, can it?
Absolutely. It allows for earlier intervention and potentially better outcomes. It also gives individuals more time to make informed decisions about their health and their future.
It's about empowering people to be active participants in their own care. And this deep dive has really emphasized the importance of that patient-doctor partnership.
Couldn't agree more. Open communication, shared decision-making, and a holistic approach to care
Yeah.
are essential for anyone living with a chronic condition
Right.
like PKD.
So as we wrap up, what's the one key takeaway you'd like our listener to remember about PKD?
I think the most important message is this. PKD is a complex and serious condition, but it's not a life sentence. With early detection, proper management, and a strong support system, people with PKD can live full and meaningful lives.
That's a powerful message of hope.
It is.
And to our listener, thank you for joining us on this deep dive into the world of PKD. We've covered a lot of ground, from the science to the personal stories, and we hope you found it both informative and thought-provoking.
It's been a privilege to share my insights with you today.
And remember, knowledge is power.
It is.
The more we learn about PKD, the better equipped we are to support those affected by it and advocate for progress. Until next time, keep exploring, keep learning, and keep asking questions. You're right. It's easy to get caught up in the medical details
Yeah.
and forget about that human side of things.
It's understandable, PKD is a complex condition, and it can be overwhelming to try to grasp all the medical intricacies.
Right.
But it's so crucial to remember that we're talking about real people here.
Yeah.
Not just a collection of symptoms.
Exactly. So let's delve into that human experience. What are some of the emotional and social challenges that someone with PKD might face?
Imagine this. You're in your 20s or 30s, maybe you're just starting a family or
Yeah.
building a career, and then you get hit with this diagnosis.
Yeah.
A chronic progressive disease that could ultimately lead to kidney failure.
Wow. That really puts things into perspective. It's not just dealing with, the physical symptoms. It's like facing the uncertainty of the future.
It is. The emotional toll can be immense. anxiety, fear, even a sense of grief
Wow.
over the life you envisioned. These are all very real
Right.
and very valid emotions.
And then there's the impact on relationships too. How does PKD affect the way that someone interacts with, their loved ones?
Yeah. It can be tough. Some people might, feel like they're burdening their family and their friends
Right.
with their illness, while others might just withdraw and isolate themselves. And then there's also the added stress of,
Yeah.
of managing all the practical aspects of,
Yeah.
of the disease, the doctor's appointments, the treatments, the lifestyle changes.
Speaking of lifestyle changes, the notes mention this patient has a family history of PKD. What does that mean for their relatives?
That's a crucial point because PKD is genetic.
Right.
Family members of someone with the condition, they're at increased risk themselves.
Right.
And so genetic testing can be a double-edged sword.
Yep.
It can provide answers, but it can also bring up a lot of, anxiety and difficult decisions.
Yeah. Imagine finding out you might have inherited a condition that could significantly impact your future.
Exactly.
That's heavy stuff.
It is, and it highlights the importance of, open communication
Yeah.
within families, sharing information about PKD, talking about the risks, and supporting each other, through genetic testing. These are all crucial steps.
So knowledge and support are key,
Yeah.
both for the person diagnosed with PKD
Right.
and for their loved ones. But let's go back to the patient that we're focusing on today. What resources and support systems are available to help someone navigate the challenges of living with PKD?
Well, thankfully, there's a growing network of support available,
Good.
these days. Support groups, both in person and online, can provide a sense of community and shared experience.
That sense of belonging can make such a huge difference, I think.
Yes.
Knowing that you're not alone in this journey.
Certainly, it can be incredibly empowering.
Yeah.
And it's not just about emotional support. These groups can also be, a valuable source of practical information,
Yeah.
and tips for managing, the day-to-day challenges of PKD.
Like figuring out how to navigate those dietary restrictions,
Yeah.
or finding, creative ways to stay active, despite the fatigue.
Right, yeah.
Sharing those experiences can be so helpful.
Absolutely. And beyond support groups, there are also mental health professionals who specialize
Right.
in working with people
Mm.
with chronic illnesses.
Right.
And they can provide tools and strategies for coping with the anxiety, the depression, the emotional roller coaster
Yeah.
that often comes with PKD.
Yeah. It's a good reminder that taking care of your mental health is just as important as taking care of your physical health, especially when you're dealing with a chronic condition like PKD.
You're absolutely right. And there are, resources out there to help people access these support systems. Organizations like the PKD Foundation, they offer a wealth of information. They connect people with local resources, and they advocate for more research
Right.
and better treatments.
So it's not just about individuals navigating this journey alone. It's like a whole community,
Yeah, it's
coming
just-
together to provide that support, raise
Very much.
awareness and push for progress.
Exactly.
But for someone who's just been diagnosed with PKD, it can be so hard to know where to even begin.
Right.
What advice would you give them?
I think the first thing I would say is don't panic.
What?
Take a deep breath. Gather information from reliable sources and talk to your doctor.
Yeah.
Ask questions. Be your own advocate and remember that knowledge is power.
It's about taking control of your health journey and finding a healthcare team that you trust and can work with.
Exactly. And I'd also encourage them to connect with others who have PKD, whether it's through, a support group or an online forum or even just talking to someone who understands what they're going through. Sharing those experiences can be so validating and helpful.
It's about finding that sense of community and realizing that you're not alone in this.
Yeah, you're not.
And of course, there are lifestyle changes to consider as well.
Right. Absolutely. Managing blood pressure, making healthy dietary choices, staying hydrated, finding ways to incorporate, some gentle exercise into your routine.
Hmm.
These are all things that, you can do to help, slow down the progression of PKD and manage your symptoms.
It's about focusing on the things that you can control,
Yeah.
even in the face of a condition that can feel like so overwhelming at times.
Exactly. And remembering that even small changes
Yeah.
can make a big difference
Right.
in the long run.
Absolutely.
It's about taking an active role in your own health and well-being.
Yeah.
And as we continue to learn more about PKD and develop new treatments,
Right.
there's reason to be hopeful.
That's an important message. So we've talked about the emotional and social aspects of PKD, the resources available, the importance of lifestyle changes. But what about the bigger picture? What are some of the broader implications of living with a chronic condition like this?
That's a great question, and it brings us to a really crucial aspect, of the human experience with PKD, and that is the impact on identity and self-perception.
Okay.
When you're dealing with a chronic illness, it can be very easy to, to let the disease kind of define you.
It's like PKD becomes the lens through which you see yourself
Exactly.
and the world.
Yeah, and that can be a real struggle for people.
Yeah.
But what's important to remember is that you are not your disease. You are a whole person
Right.
with unique strengths and talents and passions.
It's about holding on to that sense of self, even amidst the challenges of PKD.
Absolutely, and it's about finding ways to live a full and meaningful life, even with the limitations that PKD might impose. It's about adapting, adjusting, and finding joy in those everyday moments.
I love that perspective. It's about, resilience. It's about finding that inner strength to navigate, the ups and downs of living with a chronic condition.
It is, and it's about recognizing that you're not alone on this journey.
Yeah.
There's a whole community out there. People who understand your struggles and who are cheering you on.
Yeah, it really is. It's inspiring to see how people with PKD find ways to not just cope, but to really live their lives, to the fullest.
It is, it speaks volumes really about the human spirit. There's this incredible ability to adapt and to find meaning even in the face of adversity.
This deep dive has really opened my eyes to the multifaceted nature of PKD. We've explored the science, the treatments, the emotional impact, and even the social aspects. But as we kind of wrap up here, I want to circle back to those patient notes for a moment. There's a detail we haven't really discussed yet. The mention of a scar on the patient's chest, possibly from a previous line insertion for hemodialysis.
Ah, yes. That seemingly small detail, it really speaks volumes about the long-term reality of PKD for a lot of patients. Dialysis is often a necessary bridge to transplantation, and it can go on for years.
Yeah, it's a stark reminder of the physical and logistical challenges that people with PKD face on a daily basis.
It is.
It also highlights the need for ongoing research and innovation in the field of dialysis. We need to find ways to make this life-sustaining treatment more comfortable, more efficient,
Yeah.
and more accessible to people. Speaking of research, what are some of the most promising advancements happening in the world of PKD right now?
Oh, there's a lot to be excited about. Scientists are exploring a whole range of approaches from gene therapies that target the root cause of the disease to drugs that aim to slow down or even
Yeah.
halt cyst growth.
Wow, so there's real hope for a future where PKD is either cured or at least managed much more effectively.
Definitely. And beyond those cutting edge therapies, there's also a lot of focus on improving the quality of life for people, with PKD. Researchers are looking at better ways to manage pain, to control blood pressure and address the various complications that can arise.
It's encouraging to know that progress is being made on multiple fronts. But beyond the scientific advancements, what else needs to happen to really truly improve the lives of people living with PKD?
Well, I think awareness is key. The more people understand about PKD, the more likely they are to recognize the symptoms, to seek early diagnosis and to support research efforts.
And early diagnosis can make a world of difference, can.
Absolutely. It allows for earlier intervention and potentially better outcomes.
Mhm.
It also gives individuals more time to make, informed decisions about their health and their future.
It's about empowering people to be active participants in their own care.
Yeah.
And this deep dive has really emphasized the importance of that patient-doctor partnership.
Yeah, couldn't agree more. Open communication, shared decision making, and a holistic approach to care.
Yeah.
These things are essential for anyone living with a chronic condition, like PKD.
So as we wrap up here, what's the one key takeaway you'd like our listener to remember about PKD?
I think the most important message is this. PKD is a complex and a serious condition, but it's not a life sentence. With early detection, proper management, and a strong support system, people with PKD can live full and meaningful lives.
That's a powerful message of hope. And to our listeners, thank you for joining us on this deep dive into the world of PKD. We've covered a lot of ground from the science to the personal stories, and we hope you found it both, informative and thought-provoking.
It's been a privilege to share my insights with you.
And remember, knowledge is power. The more we learn about PKD, the better equipped we are to support those affected by it and advocate for progress. Until next time, keep exploring, keep learning, and keep asking questions.